welcome and thank you for accepting my invitation.
You're welcome. Thank you very much for having me.
As an ANF Academy Manager, can you describe or provide an overview of your role and responsibilities?
So my role as an ANF Academy Manager is to bring to all healthcare professionals Dr. Mikkel H.G. knowledge. So we are putting together in several education programs this advanced knowledge and unique understanding of the human body together with the usage of the ANF device and the ANF therapy method. The most important responsibility as an ANF Academy Manager, I will say, is the surveillance of the performance and safety of the ANF medical device. For that, we control, assess, and check all the ANF cases that our ANF students are uploaded into the system. So that's an interesting part of my job that makes sure that the ANF device works accordingly to any Ministry of Health and organization.
For those that are unfamiliar with ANF Academy, can you explain what is ANF Academy mission and its main goals?
ANF Academy is made for healthcare professionals. We are offering a unique understanding of the human body, especially the neurological system, and at the same time we are also offering an advanced technology that is the ANF device and can help reduce inflammation within minutes. So all our healthcare professionals are using the ANF therapy method to help their patients with many different symptoms and injuries.
Does that mean that they combine the knowledge they gained before enrolling in education together with knowledge they can gain during the education?
Absolutely. Yes, the healthcare professional will combine the new knowledge provided by ANF Academy with the new tool, the ANF device, together with their own background and their own different techniques that they have been developing. For example, we have physiotherapists that are using their own rehab techniques together with the ANF device, as well as we have doctors that are combining their own treatments with ANF therapy.
So, to enroll in ANF education, there must be some kind of criteria. Can you explain?
Yes, the ANF education is only for healthcare professionals, those that have a university degree with a medical background and a license to treat injuries or diseases. So we have a thorough onboarding process where we verify this qualification from our students of ANF therapy.
What kind of educational backgrounds are accepted?
Any healthcare professionals with a medical background, for example, physiotherapists, medical doctors, sport therapists, nurses, osteopaths, chiropractors, and many more.
What is the most common obstacles and challenges, in your opinion, that healthcare professionals face before they join ANF education, and how ANF helps them overcome those challenges?
The most common weakness that most of the healthcare professionals have in their own clinical practice is that they normally address the symptom. They approach always the pain or where the patient complains of any type of issue. And with ANF therapy, we help them. We give them the understanding and we give them the tool to approach the root cause of the problem directly. So that means that the patient will get faster results and also long-term benefits from the method.
As I said earlier, you're also one of the main instructors. So how do you help healthcare professionals grow and develop?
We have an ongoing mentoring during the program, during the education program, but we also go with that mentoring beyond the program. That means even when the students of ANF therapy becomes certified, we also continue doing this mentoring and we help the healthcare professional to achieve the best result using the ANF therapy method. So we are in continued and constant support to all our therapists.
So for example, if a practitioner struggles with a certain diagnosis, it can contact you Or is there a forum or coaching sessions where the therapist can ask questions about that certain case?
Yes, absolutely. There are many different options during the program. In the e-learning platform, of course, we have a forum where every student can ask the questions, and other students with more practice or with better experience can answer there, as well as all the ANF instructors can also answer the questions in that platform. We have other systems, more individualized and more personalized mentoring, and one of the best mentoring strategies that we are using is the coaching sessions. At least one, twice, or sometimes 3 times per month, we have live sessions with the students and already certified ANF practitioners that are attending this live session, asking their questions and getting the answer directly.
It looks like it's a community.
Yes, we call it. It's the ANF family.
So what would you like to say about ANF family or community?
So we have we are healthcare professionals from all over the world. We have a strong bond. We talk to each other. We help each other. And it's not only in one direction. It's not only the instructor that is helping the students or the therapist. It's everybody is helping each other, and we learn from each one as well.
That's very nice, because usually other courses or educational programs, once it's done, you're done, right?
Mm-hmm. Yes, absolutely. I have taken other education programs that can take as well the 1 year plan, and then when that year is over, you're kind of out of the system.
And you're on your own.
I'm on my own, and if that program develops, because the knowledge, it keeps growing and developing, we will never know of that progress from that new education plan. On the contrary, with ANF, if we update something from our program, or if we change or we give more knowledge, we will inform all our current students, but also already certified practitioners to reattend and to understand, to get to know, to be everybody at the same level all the time.
What are the principles and techniques taught in the ANF Academy that differentiate ANF education from other medical educational programs?
Mm-hmm. One of the most important modules of the ANF education is about the neurological system, which is taught in a different way compared to other university or education programs, because it covers more into the frequency medicine aspect. So with teaching the ANF, the neurological system, and understanding how it works and all the functions, the therapist is able to really find the root cause of the problem instead of going into the symptom, as we mentioned before. And also with the ANF device is able to address directly the root cause of the problem. I believe that's the biggest difference compared to other programs.
But do you teach them to use a certain diagnostic equipment, or how they can find the root cause? How do you teach them?
And in ANF, we believe that all healthcare professionals should be able to do an examination with their own hands. What we teach is the neurological examination, where we follow mainly the nerve pathways, and we do a very thorough examination of all the tissues and details of the human body. With this neurological examination, a physiotherapist and an osteopath or a medical doctor can find the root cause of the problems. We don't need extra equipment for the diagnosis or any expensive machines to tell you what to do. So with our own hands, we are able to do a complete assessment of the patient and get a diagnosis and the treatment at the same time.
Is it possible to locate the underlying cause within the first treatment?
Absolutely, yes. Actually, after the first course, which only takes 9 hours of online interactive training, our students of ANF therapy can achieve already incredible result, like decreasing pain by 50% within 10 minutes. This is something that our students of the first level of the course can achieve that. And they are doing thanks to the knowledge that we provide within the course, and also thanks to the tools, that the devices that they get in the first level. This is something that they can achieve in the first visit, and of course in the follow-up visit the patients feel just better and better.
So already the first course provides enough knowledge for them to find the root cause within the first treatment.
Correct, yes. The first course focuses on inflammation on the soft tissue injuries. For example, muscle pain or muscle inflammation or any type of tendinopathy. With the first level, the student of ANF therapy can already create an ANF protocol, apply the devices, and achieve these results, like 50% pain reduction within 10 minutes.
Do you provide general protocols, so students basically need to look and know where to apply, or you teach them how to combine devices and have individual approach?
We have both. We have standard protocols that we are using for most common injuries, for example, a tendinopathy of the bicipital tendons, of low back pain or neck pain. We have standard protocols that we have seen over the years of clinical practice that they work really good. But the ANF therapy is always individual, it's always personalized. So the therapist is going to create a protocol based on the patient's need. So these standard protocols can also be modified based on the injury that the patient has.
Okay, which conditions or alignments showed notable improvements with ANF?
We have many cases. One of the most attractive benefits or aspect of ANF therapy is that it works for many conditions, for most of the conditions, especially when there is inflammation related. On the other, it means that everything, any type of pain. One of the cases that is more relevant could be patients, for example, with shoulder pain. Because a shoulder injury can have many different reasons, right? Coming from a tendinopathy or a joint issue. But sometimes many healthcare professionals will know what I'm about to say, that the shoulder pain can be organ related. And with ANF therapy, as we said, we are not targeting the symptom only, we are able to target the root cause. So we have seen cases, and also our students of ANF therapy have seen cases where applying just a couple of devices on the liver area, the patient has gotten better range of motion, less pain, just by addressing the organ instead of addressing the shoulder itself.
What I've seen till now is that people and therapists in general like to hear success stories. So can you share a little bit more?
I can talk more about low back pain, because low back pain is one chronic condition that many patients have, and many patients will go to a healthcare professional to get rid of that constant pain or that crisis. With ANF education, we help the student and the ANF therapist to approach low back pain and target the root cause of the problem. For example, the reasons for low back pain can be from weak gluteal muscles, from inflamed nerves around the pelvis, or it can be even gut related. So there are different possibilities where the patient can have this problem, and the ANF therapist is able to approach any of them. So the ANF therapist can decide, for example, to do a protocol for the psoas if the low back pain is psoas related. The ANF therapist can also create a protocol for the gut if that could be the reason for that low back pain. And the cool thing with ANF therapy is that the therapist can see the result immediately. That means the patient is on the bench, the ANF therapist makes a decision, creates the diagnosis, creates the protocol, and apply the ANF devices. And within 10 minutes, you can already see the patient moving differently and experiencing that pain reduction. So that's something that one of the important effects of ANF therapy is how fast it works and how you can do within one visit, you can rule out some of the root causes or some of the inflammations in the patient.
Let us clarify, it's not one treatment is not enough, or there are cases when one treatment can be enough.
We have seen both cases. Sometimes the injury is just a little bit of an amount of inflammation that when we apply the ANF devices, we help the body to normalize the neurological frequencies so the patient can heal by itself. Sometimes that can take a short time. Sometimes the patient with a chronic injury, it needs a further visit, because with the ANF devices, we're approaching different layers of tissue in the different visit. That means that in the first visit, we're approaching more superficial layers where the inflammation is located. And in the following visit, we're approaching deeper and deeper inflammation in the tissue layers. So that's why many times we need a treatment plan to approach the case.
Can you give us more information about ANF devices?
Yes, the ANF devices is a advanced technology. Is made of different layers. One of the layers, of course, is the 3M adhesive tape. There is another layer, is a PET material, and the most important layer is a carbonized metal, where there is carbon fragments that the frequency is storage. Is these carbon fragments the one that will storage the frequency and the ones that will get activated by the body heat and will start releasing the frequencies through the skin towards the neurological system. So then after, when they reach the neurological system, the neurons will copy this information and will restart the healing process and repair. So that's our goal, is to reset that neurological frequencies in the system.
Are there several ANF devices, or how many different devices you have?
We have many different devices. We have more than 300 currently, but the ANF therapy method for orthopedic injuries contain 48 different devices where the therapists learn how to select the device that they want to use for a specific injury, and they are able to combine the different devices to create the ANF protocol. The ANF device is safe to use on any age. It can be used on babies, on child, teenager, adults, even on the elderly. So it's very safe and effective for all these ages groups. What we need to be aware is about the power of the ANF devices. The method is so powerful that when we apply the devices on the human body, immediately the inflammation, the toxins, and all the waste products will start to go out from the system. That is what we call a detoxification process. In these cases, during the detoxification, the patient might feel a bit of dry mouth, a little bit dizzy, a little bit of headache.
For how long?
It can last, sometimes it can last, normally it will last for a few minutes. Normally they're very mild and many times on the first visit, but we have seen that in people where their bodies need to detoxify stronger, they might feel like a strong detoxification reaction, and it can last for a few hours and sometimes for a few days. But the patient understands this process because of the ANF therapist will explain to the patient about the need of detoxify and to eliminate all these waste products before healing can start.
For how long devices can be on the skin?
We apply the ANF devices on the skin, and the frequencies will be releasing towards the neurological system for 72 hours. That means that after 72 hours, we are changing for new devices, which normally are of stronger frequency to reach deeper tissue layers. So we have a treatment methodology where in every visit we will change the devices that we are applying.
So that means that ANF devices can't be bought somewhere else, in a pharmacy or in a hospital, or must be bought only from ANF therapists?
The ANF devices can only be purchased by healthcare professionals that have taken ANF courses with ANF Academy. So they are not available on the pharmacy or any other store, only through the healthcare professional.
What would you say, what are the main advantages of using ANF therapy?
One of the greatest advantages is that it works for many different conditions. Also that with ANF therapy, the therapist can approach multiple injuries at the same time. Mm-hmm. You don't have to wait until one injury gets better to be able to start with the following one. The treatment allows simultaneous treatment at the same time. Of course, the most impressive benefit is to reduce pain mm-hmm. by 50% within 10 minutes. This is something that is only possible by addressing the neurological system and targeting the root cause of the problem.
Are there any upcoming courses or programs scheduled for future?
Yes. Dr. Mikkel is always creating new knowledge, and he wants all the ANF therapists to get that understanding, this holistic understanding of the human body. That's why we have 2 new programs coming. One is about prevention medicine, which will help many healthcare professionals, for example, nurses, mm-hmm. Or medical doctors, and many other health practitioners that will stop the development of inflammation. That means that the patient will not suffer from common complaints like a sore throat, ear infection, or minor type of pain. As well, we have a bigger program. It's called Neurobioholistic Education Program that will help healthcare professionals to approach the human body as a unit and to help the patient with many different types of symptoms. Because as we said before, any symptoms is inflammation related.
Can you give an example of what kind of symptoms?
Yes. Patients that will need an ANF holistic treatment are patients that complain of fatigue. Mm-hmm. They feel tired all the time. They don't sleep well and they wake up exhausted in the morning. They might have bloating or problems with the digestion. They might have skin issues that they don't know why they are appearing. Also, they might feel extremely weak. They cannot do any type of a sport. Or many others like normal symptoms like a high blood pressure, high heartbeat, low oxygen saturation, and problems with the glucose and any organ-related problem.
Do you have a message for those that are interested in enrolling in ANF education but they haven't enrolled yet?
Yes, that is the first level is just 9 hours of interactive online training and is very manageable to do the first course and then to try for yourself. The most impressive effect of ANF is when you see it by yourself. Even if you have an injury yourself, you can create a protocol and apply on your injury and you notice immediately how ANF therapy works. Or if you have a patient with a chronic injury that you have tried many different techniques, you have done everything you have learned during your professional career, and after these 9 hours of learning, you can try ANF therapy and you will see for yourself. It's better always to try instead of being skeptical forever. So give it a try for sure.
Thank you very much for this interview.
You're welcome.